Turning now to our coronavirus coverage tonight, another Utah hospital feeling strained with a current surge of COVID patients. ABC4's Northern Utah correspondent Kate Gardner has the story.
What we're seeing is hospitalizations are increasing.
That's been the trend in Davis County during September, and the Davis Hospital and Medical Center is feeling the strain with a full ICU.
It's been really difficult to be able to manage the patients that are needing an ICU bed because COVID patients do take a lot more time in the hospital to be able to recover.
Chris Johnson says at the hospital at any given time, about half of the ICU beds are COVID-19 patients, and they often are in the ICU for more than 20 days, which is 3 times longer than the average patient.
Affects how many patients we can adequately take care of.
And this is happening across the county.
We're seeing hospitalizations at the same number that we did in the peak of the last wave.
Johnson says there is a difference during this wave. The patients are younger and sicker.
I think a lot of that has to do with the fact that a lot of older people received the vaccine, and so we're just not seeing that age group typically in the hospital with COVID.
He says this is taking its toll on healthcare workers.
It's been really difficult to see what should be young, healthy people to actually die from this, and knowing that not everything was done because of a choice that they made.
He says in most cases, this outcome is preventable.
The vaccine is truly the answer to being able to combat a lot of the COVID issues that we have.
In Layton, Kate Garner, ABC4 News.